Chronic or non-healing wounds are one of the most difficult and expensive medical conditions to treat. A chronic wound is one that does not heal through the normal stages of healing. Most wounds typically heal in 3 months or less, whereas those that take longer are considered chronic. Chronic wounds may take years to heal, or in some instances, never heal. These wounds cause patients severe emotional and physical stress, as well as creating a significant financial burden on patients as well as the entire healthcare system. Though treatment of the different chronic wound types varies slightly, appropriate treatment seeks to address the problem at the root causes of these wounds, including ischemia, bacterial load, and imbalance of proteases. Various methods exist to ameliorate these problems, including antibiotic and antibacterial use, debridement, irrigation, vacuum-assisted closure, warming, oxygenation, moist wound healing, removing mechanical stress, and adding cells or other materials to secrete or enhance levels of healing factors. While the treatment of chronic wounds is a very complex science, the protocols can be broken down into 4 basic steps. Debridement, which entails the cleaning of the wound and removal of any necrotic or dead tissue. Bioburden control, which is the reduction or elimination of microbes such as bacteria, viruses, and fungi that infect the wound. Reconstruction, or the building up of granulation tissue to heal the wound, and protecting the wound and creating the correct level of moisture, typically through use of a cover or secondary dressing. Deroyal offers an all-natural, unique and extremely effective wound dressing, classified as a wound filler, called Multidex. Multidex was developed by Dr. Anthony Silvetti in the late 1980s and early 1990s, based on his investigations of maltodextrin for wound healing applications. Multidex is a 3-in-1 topical dressing that accomplishes 3 of the major steps in wound treatment. It facilitates autolytic debridement, it offers superior bioburden reduction, and it creates an ideal environment to promote the body's natural healing processes. In addition, Multidex helps to maintain a moist wound bed environment. It decreases and helps to control odours, it decreases purulent exudate, and it penetrates and fills all the wound areas. The primary active ingredient of Multidex is hydrophilic maltodextrin, a natural D-glucose polysaccharide polymer that is obtained from the hydrolysis of plant starch. Maltodextrin helps to maintain a moist wound bed environment. Laboratory testing using polymorphonuclear leukocytes has shown that maltodextrin attracts these cells at a rate of 185 cells per field. Other elements attract cells only at rates of between 4 and 90 cells per field. This laboratory testing suggests that Multidex attracts white blood cells, specifically leukocytes, lymphocytes, and monocytes, to the wound beds. These white blood cells clean the wound and digest debris and bacteria through phagocytosis. Maltodextrin has been clinically proven to maintain a moist environment beneficial for the growth of granulation tissue and epithelial proliferation. The endothelial cells promote the rapid growth of highly vascularized granulation tissue. Meanwhile, the fibroblast cells promote growth of collagen, the structural component of skin regrowth. The second active ingredient is ascorbic acid, more commonly known as vitamin C. The ascorbic acid lowers the pH of the wound bed to about 4.2, thus creating an acidic environment. This disrupts the cell wall membrane of bacteria, resulting in bacteriostatic and bactericidal effects. In vitro tests have shown that Multidex has this effect on aerobic as well as anaerobic bacteria, and on both gram-negative and gram-positive bacteria. And by reducing the bacterial load and decreasing purulent exudate, Multidex helps to control odours typical of chronic wounds. The vitamin C is also required for collagen synthesis, essential for wound healing. Multidex is available in either a powder or a gel in a number of convenient tube sizes. Both help to fill wounds completely by penetrating all irregularities to fill tunnelling and undermining wounds. Multidex powder is recommended for use on wet to moist wounds, meaning those with high to moderate amounts of exudate. The Multidex powder fills the wound site, rapidly mixing with wound exudate to form a protective gel to create an ideal moisture balance beneficial for granulation, tissue growth, and epithelial proliferation. This gel also softens eschar and necrotic tissue to aid in autolytic debridement. Multidex gel is typically used on dry wounds with little to moderate exudate. The gel is specially formulated by adding glycerin and water to Multidex powder. Clinical findings show Multidex gel has the same unique performance and characteristics as the powder to better protect the wound against dehydration and to soften eschar and necrotic tissue. Many clinicians find that the gel is easier to apply on difficult to access areas of the body. Multidex has a broad range of indications and may be used successfully on many wound types, including those that are infected. Multidex can be used on most of the following wounds. Since the introduction of Multidex in the wound healing community, the success of this wound dressing has been documented through presentations at scientific meetings and in published case studies. In a 2014 clinical trial conducted by Dr. Jorge Puerta in Panama, Multidex was found to evoke rapid granulation tissue formation, with each patient achieving at least 90% granulation of the wound bed by week 5, and the average percent wound closure was 96% at 12 weeks post-treatment for all patients. All wounds in the study were completely healed within 4 months of initial treatment, and rapid wound healing was demonstrated through resolution of wounds in as little as 7 weeks. Multidex is completely non-toxic and is made from 100% natural ingredients. Multidex is safe for use on any part of the body, can be applied to bone or tendon, and is safe even if accidentally ingested. It is not systematically absorbed, so it can be used on all patients, regardless of comorbidities. Because it has no impact on patients' blood glucose levels, it is safe for use on diabetic patients as well. The frequency at which Multidex is changed or reapplied is dependent on the level of exudates from the wound. The normal change frequency is once per day. Low draining wounds can be changed less frequently, while high draining wounds will require more frequent changes. Multidex is a very simple, all-natural wound dressing. It has been shown to be clinically effective with its 3-way action of autolytic debridement, attraction of cells, and bactericidal and bacteriostatic effects. As an all-natural product that is safe, effective and economical, Multidex is the choice of wound care clinicians globally. Multidex, just one more way that De Royal is helping to improve care and improve business around the world.